Colton here at Preferred Physical Therapy, where we help those 40 and above stay active and independent, live free from painkillers, and avoid surgery. So today I'm going to be talking about vertigo. And vertigo is that kind of spinning movement that we feel. Sometimes it can feel like the room is spinning. Sometimes it feels like the entire room is spinning, or just movement when we're not moving without those eyes moving at the same time. Sometimes vertigo can come up from when we are laying on bed and we transfer to then into a sideline position, but vertigo almost always originates somewhere in the vestibular system, whether that comes from the inner canals of our ear, which I'll talk about a little bit later, or other times it comes from the nerves, or sometimes even the brain. But going about those semicircular canals in our ear, or those inner ear canals, they have three semicircle canals, and those three semicircle canals, one senses our up and down movement, the other one kind of goes side to side, and then the other one does like a tilting kind of motion. With those motions, they also sense when we aren't moving, such as if we're going up and down an elevator, such as going into a car, moving forward and backward, or even side to side, even though our body's not moving, but where we are at in space actually is. And our brain uses this information to know where you are in space, which is why when we have vertigo and we have those kind of spells where that room feels like we're spinning, our brain can't process exactly where we are, and we get thrown for a loop, which greatly increases our risk of falling, which is no fun. When we use this kind of information, we use that along with what we see visually and what we feel, like on our feet, or if we're touching things. Usually why when we do get vertigo symptoms, we like to lay down and hold and grasp something so we know we're not going to fall. But when things are all working together, we have pretty good balance, or at least we should, because we have these three different senses of telling us where we are. But that vestibular system, or those inner ear canals, kind of work a lot to keep us upright and tell us where we are at in space. When we do have those vertigo symptoms, those brain signals say the room is spinning, or we feel like we're falling, but we're not. It really throws us for a loop and can have us have symptoms of nausea, or has us feel like we're going to fall even more. Our balance is tied heavily to our inner ear, and no matter what we think, we rely heavily on this system to keep us upright. We do have to make sure that if we do have these sort of problems, these vertigo problems, we want to go get them seen by a professional through doctors. Going to see your primary care specialist. Sometimes you can see a physical therapist if it's the right diagnosis, such as BPPV, which is one of the most common vertigo diagnoses out there. Or you can see a nose, throat, and ear doctor who typically sees and specializes in these kinds of things. If you guys have any other questions, please give us a call. Please check out our other posts to help you find joy in your journey. And you guys have a great day.